Have you ever wondered if the side you sleep on actually matters? Most of us don't give it a second thought. We just climb into bed, get comfortable, and hope for a good night's rest. But here's the surprising truth. The side you sleep on can have a real impact on your health. And not just your comfort or your ability to fall asleep. We're talking digestion, heart health, breathing, and even brain function. Let's start with the basics. There are three main sleeping positions: on your back, on your stomach, or on your side. Among side sleepers, there are two options: sleeping on your left side or your right side. And while all positions have their pros and cons, side sleeping is generally considered one of the healthiest. But here's where it gets interesting. The side you choose actually makes a difference. Let's talk about sleeping on your left side first. This position is often recommended by doctors and sleep experts, and for some really good reasons. One of the biggest has to do with digestion. Your stomach and your pancreas sit slightly on the left side of your body. When you lie on your left side, gravity helps the food move more easily from your stomach into your small intestine. This can help your digestive system work more efficiently while you sleep. People who suffer from acid reflux or heartburn, especially after eating late, often find that sleeping on their left side reduces those symptoms. That's because the shape of your stomach and the position of your esophagus work together better on the left side. Stomach acid is less likely to flow upward when you're lying left side down. It's not magic, it's simple anatomy, and it doesn't stop there. The heart also benefits from left side sleeping, especially for certain people. Your heart sits more toward the left side of your chest. Sleeping on your left can improve circulation and reduce pressure on your heart. This is especially helpful for people with high blood pressure or heart disease. It's also why doctors often recommend left side sleeping during pregnancy, to improve blood flow to the heart and the baby. Speaking of pregnancy, let's go deeper for a second. In pregnant women, especially during the later months, the growing uterus can press against major blood vessels in the abdomen, including the inferior vena cava, which returns blood from the lower body back to the heart. Sleeping on the left side keeps that blood flowing freely. That's why left side sleeping is widely recommended for pregnant women, especially during the second and third trimesters. Now let's talk about the lymphatic system. This is the body's drainage system. It helps remove waste, toxins, and excess fluids. And here's where things get even more interesting. Most of the lymphatic drainage in the body flows to the left. That means sleeping on your left side may actually help your body clear waste more efficiently, especially from the brain. In fact, some research suggests that the brain clears out toxins more effectively during sleep, particularly when lying on your side. It's a process called the lymphatic system, and scientists believe it might be connected to long-term brain health. While we still need more research in this area, early studies in animals have shown that side sleeping, especially on the left, could help the brain stay cleaner over time. Pretty wild, right? But wait, let's not jump to conclusions just yet. Sleeping on your right side has benefits too. It's not all bad. For some people, the right side might actually feel more natural or more comfortable, and depending on your health conditions, it could even be the better choice. Let's say you have heart failure. In some cases, sleeping on the right side may actually help reduce discomfort and pressure on the heart. People with certain heart issues sometimes feel a heaviness or discomfort when lying on the left. So for them, the right side may be more comfortable, and that matters. A good night's sleep is better than no sleep at all. Now, what about your lungs? Believe it or not, the side you sleep on can affect how easily you breathe. The lungs are slightly different sizes. The right lung is a bit larger and has 3 lobes, while the left lung has 2 to make room for the heart. In general, sleeping on either side can help improve breathing compared to sleeping on your back, especially for people with sleep apnea or snoring issues. But in some cases, sleeping on the right side can slightly reduce pressure on the heart and lungs, which might help certain people breathe better. Still, for most healthy people, left side sleeping tends to win when it comes to long-term benefits. But we're not done yet, because while left side sleeping sounds like a clear winner, it's not perfect. There are some downsides. For one, it can put extra pressure on your left shoulder and left hip. Over time, this can lead to soreness or even nerve compression if your mattress or pillow isn't supportive enough. People with shoulder injuries or arthritis might find this position uncomfortable. Also, some people report waking up with numb arms or hands when they sleep on their side. due to compressed nerves or poor circulation. That's something to pay attention to. And while sleeping on your back or stomach may seem more relaxing for some people, those positions come with their own problems. There's another interesting angle here: how sleep position affects your skin and appearance. Most people don't think about this, but it's true. Your face spends hours every night pressed against a pillow. Over time, this can contribute to wrinkles or puffiness, especially if you sleep on one side more than the other. Some dermatologists even say you can sometimes tell which side someone sleeps on just by looking at their face closely. So if you care about your skin, you might want to switch sides every now and then, or try using a silk pillowcase. It won't stop aging, but it might help a little. Here's something else you might not expect. Your bowel movements can be affected by how you sleep. Sleeping on your left side helps the colon work with gravity. That means it's easier for waste to move through the large intestine and toward the rectum. People who struggle with constipation might find that left side sleeping helps them go to the bathroom more regularly. It's not a cure, but it's a simple, natural way to support digestion overnight. So to sum it up, here's what we've learned so far. Your sleep position matters, a lot more than most people realize. And among the side sleeping options, the left side comes with more benefits for most people. It helps your heart, your stomach, your brain, and your body's natural waste removal system. But that doesn't mean it's the best choice for everyone. Some people feel better on their right side, especially if they have certain medical conditions. And for others, pain or discomfort might make side sleeping hard in general. That's why it's important to listen to your body. Pay attention to how you feel in the morning. If you wake up sore, stiff, or still tired, your sleeping position could be part of the problem. And a small adjustment could make a big difference. Now let's talk about back sleeping, also called the supine position. This is actually considered one of the most natural ways to sleep. When you lie on your back, your head, neck, and spine stay aligned in a neutral position. That means less pressure on your joints. For some people, this can reduce pain in the lower back or neck, especially if they use a supportive pillow. Sleeping on your back also keeps your face from being pressed into a pillow all night. That might help prevent wrinkles or puffiness in the long term, a small bonus for your skin. But there's a big downside to back sleeping, especially if you snore or have sleep apnea. When you sleep on your back, gravity pulls your tongue and soft tissues toward the back of your throat. This can partially block your airway, leading to snoring, disrupted breathing, or full-on sleep apnea. That's why back sleeping isn't usually recommended for people who have breathing problems at night. Even if you don't have sleep apnea, you might notice that you wake up feeling groggy, unrested, or with a dry mouth after back sleeping. Those could all be signs that your breathing was affected. There's also the issue of acid reflux. Just like with side sleeping, lying flat on your back, especially without a raised pillow, can let stomach acid move up into your esophagus. That can cause heartburn or that annoying burning feeling in your chest. If you do prefer to sleep on your back, try elevating your head slightly with a wedge pillow. That small angle can reduce the risk of acid reflux during the night. Back sleeping also isn't ideal for pregnant women. In the later stages of pregnancy, lying flat on your back can put pressure on the vena cava, the large vein that brings blood back to your heart, and that can reduce blood flow. That's why side sleeping is strongly recommended during pregnancy, especially on the left. Now let's talk about the most controversial position: stomach sleeping. A lot of people fall asleep this way because it feels cozy or comforting, but unfortunately, this is the least recommended sleep position overall. Why? Because it puts your spine in an unnatural position. Your neck has to twist to the side, your lower back gets compressed, and over time, this can lead to pain in your neck, shoulders, or back. It also restricts proper breathing for some people, especially if your mattress isn't firm enough. Stomach sleeping also puts pressure on your organs. And for men, it can even put unwanted pressure in sensitive areas, leading to discomfort or poor blood circulation overnight. Still, there are some rare cases where stomach sleeping might help, like with severe snoring. Some people with sleep apnea find that sleeping on their stomach can open their airway just enough to breathe more easily. But even in those cases, doctors usually recommend side sleeping instead, especially with a supportive pillow or special sleep device. So if you're a stomach sleeper and you wake up sore, tired, or stiff, your sleep position might be part of the problem. Now let's talk about how to change your sleeping position, because it's easier said than done. We all have habits. Some people have been sleeping the same way for 10, 20, or even 50 years. So trying to switch from back to side or from stomach to side can be frustrating at first. But it is possible, and it often starts with your pillow and mattress. If you want to become a side sleeper, look for a medium firm mattress that supports your body's curves without letting your hips or shoulders sink too deeply. Your spine should stay straight, not bent or twisted, and your pillow matters more than you think. Side sleepers usually need a thicker, firmer pillow to fill the gap between the shoulder and head. If your pillow is too flat, your neck will bend down all night. If it's too thick, your head will tilt upward, and either way, you might wake up with neck pain. Some people also find it helpful to sleep with a pillow between their knees. This keeps the hips and spine aligned better and reduces pressure on the lower back. It's a small change that makes a big difference. If you're trying to stop sleeping on your back, one trick is to place a pillow behind your back so you're less likely to roll over during the night. Some people even sew a tennis ball into the back of their pajamas. Not exactly comfortable, but it works as a reminder to stay off your back. If you're a stomach sleeper, try starting the night on your side, even if you roll back over later. Use a body pillow or hug a thick pillow to mimic that tummy down feeling while still keeping your spine in a better position. The goal isn't to force yourself into one rigid position, it's to train your body slowly over time. Most of us move around during the night anyway, but spending most of the night in a healthy position can really help your sleep and your health. Before we wrap up, let's answer one more common question. Does sleep position affect mental health? This is still an area researchers are studying, but there's some early evidence that poor sleep posture, especially when it leads to bad sleep, might impact your mood, focus, and even your emotional resilience. When you're tired, everything feels harder. You're more likely to be stressed, irritable, or anxious. Over time, that can add up. Getting into a healthy sleep routine with a good position, the right pillow, and a mattress that supports your body can help you get deeper sleep. And better sleep doesn't just help your body recover, it helps your mind reset too. So let's bring it all together. If you're wondering which side to sleep on and whether it really matters, here's the truth. For most people, sleeping on the left side is the healthiest choice. It supports digestion, heart health, and lymphatic flow. It may even support brain health and better bowel movements. Right side sleeping can also be okay, especially if you find it more comfortable or if you have certain heart conditions. Back sleeping has some benefits, but can lead to snoring and sleep apnea. And it's not great for people with reflux or during pregnancy. Stomach sleeping is the most problematic, especially for your neck and spine, and it's best avoided if you can. But the most important thing is that your sleep position works for you. If you wake up feeling rested, free of pain, and full of energy, you're probably doing something right. But if you wake up tired, sore, or stiff, your position might be part of the issue. So pay attention, experiment a little, try small adjustments, a better pillow, a new mattress, or a different angle. Train your body gently over time, and remember, better sleep isn't about doing one thing perfectly, it's about doing a few small things right, night after night. Your sleep is 1/3 of your life. It deserves a little extra care. Got questions about your sleep or want us to cover a topic you care about? Drop it in the comments. We read them all. Thanks for watching, and as always, sleep well, stay curious, and we'll see you in the next one.